Hi, today's topic will be medical treatment of hypertension, the silent killer, sponsored by the Aruka Health Ministry Department, presented by Leah Diet Cooks. Medical treatment of hypertension. What is hypertension? So we'll do a little recap of what was discussed some time ago. Hypertension is known as high blood pressure. It is a long-term medical condition in which the blood pressure in the arteries is persistently elevated. High blood pressure typically does not show symptoms. However, long-term high blood pressure is a major risk. We have found that in Trinidad and Tobago, hypertension exists in 29.8% of males and 23.1% of females. 1 in 4 persons currently live with hypertension in our country, and the treatment of this condition costs approximately or close to $3.2 billion annually. So, some of the effects of hypertension. Hypertension or high blood pressure is dangerous and can lead to stroke, heart attack, heart failure, kidney disease. But the goal of hypertension treatment is to lower high blood pressure and protect important organs like the brain, heart, and kidney from damage. Right? So we need to protect these important organs from getting damaged as a result of high blood pressure. So some of the treatment of hypertension comes in many forms, from lifestyle and medical treatment. So we'll look at some of the lifestyle changes to treat high blood pressure. A crucial step in preventing and treating high blood pressure is a healthy lifestyle. You can lower your blood pressure with the following lifestyle changes. For example, losing weight if you are overweight or obese, quitting smoking. Another one, eating a healthy diet. Example, more fruits, vegetable, low fat intake, and less saturated fat. Reducing the amount of sodium in your diet, right? To less than 15,000 milligrams a day for those who have high blood pressure, and for healthy adults should try to limit the amount of sodium intake to 2,300 milligrams a day, about a teaspoon of salt. So let us look at a little bit of sodium. When we have too much of sodium, sodium and salt are the number one enemies of hypertension. More than 75% of the sodium we eat daily comes from packaged food and not the salt we add to our table. Packaged foods such as canned beans, canned soup, frozen pizza, packaged and processed meat, pastries, candies have high sodium content. So this is important that we should always read our labels before we purchase any of these products. Another way for our lifestyle changes, getting regular exercise, such as brisk walking at least 30 minutes a day, several days a week, and avoiding alcohol use. So medicines for high blood pressure. Now there are several types of medicine that can be used to help control high blood pressure. Many people need to take a combination of different medicines. If you are under 55 years of age, you will usually be offered an ACE inhibitor or an angiotensin 2 receptor blocker. If you are age 55 or older, or you are any age and of African or Caribbean origin, you will usually be offered a calcium channel blocker. So we'll talk about some of these different types of medication that is offered to us. Now, let's look at ACE inhibitor. ACE inhibitor or angiotensin converting enzyme inhibitors reduces blood pressure by relaxing your blood vessels. So some common example of these medications you will find like enalapril, lisinopril, peridopril, and ramipril. So some of the side effects that they may have is a persistent dry cough, right? Other possible effects include headaches, dizziness, and a rash. So we go on to angiotensin 2 receptor blockers. They work in a similar way as ACE inhibitors. They are often recommended if ACE inhibitors cause troublesome side effects. Some of example of these are candistatin, losartan, valsartan, olmesartan, and the possible side effects include dizziness, headaches, cold or flu-like symptoms. Then we go to our calcium channel blockers. So the calcium channel blockers reduces blood pressure by widening your blood vessels. So common examples of these are amlodipine, felodipine, and nifedipine. So the possible side effects include headaches, swollen ankles, and constipation. It is also important to note that drinking grapefruit juice while taking some calcium channel blockers can increase your risk of side effects. Diuretics, sometimes known as water pills, work by flushing excess water and salt from the body through your pee. They are often used if calcium channel blockers cause troublesome side effects as well. Common examples are indapamide, benzoflumetazide, and the possible side effects of these will be dizziness when standing up, increased thirst, needing to go to the toilet frequently, and a rash. You might get low potassium and low sodium level after long-term use of diuretics. Then we move to beta blockers. Beta blockers can reduce blood pressure by making your heart beat more slowly with less force. They used to be very popular treatment for high blood pressure, but now tend to be used only when other treatments have not worked. Common examples are atenolol and bisoprolol, and possible side effects of these includes dizziness, headaches, tiredness, cold hands and feet. So with high blood pressure, we need treatment and follow-up. After starting high blood pressure treatment, high blood pressure therapy, you should see your doctor at least once a month until your blood pressure goals is reached. Once or twice a year, your doctor may check the level of potassium in your blood. As we had learned before, diuretics can lower this, and ACE inhibitors can increase this. And often, and other electrolytes and bone creatinine levels. So we need to keep a constant check to see how our kidney functions are working once we take in these diuretics, right? So you may need to take blood pressure medication for the rest of your life, but your doctor may be able to reduce or stop your treatment if your blood pressure stays under control for several years. It is important to take your medicine as directed. If you miss doses, it will not work well. The medicine will not necessarily make you feel different, but this does not mean it is not working. Medicine used to treat high blood pressure can have side effects, but most people don't get any. If you do get side effects, do not stop taking your medicine. Talk to your doctor who may advise you and change your medicine. So, a little health principle that I will leave with you. The creator of man has arranged the living machine of our bodies. Every function is wonderful and wisely made. And God has pledged himself to keep this human machinery in healthful action if the human agent will obey his law and cooperate with God. We may behold and admire the work of God in the natural world, but the human habitation is the most wonderful. This is a quote from Ellen G. White, Child Guidance, chapter 16. So, have a good day and God bless you. Thanks for listening.